Medication can help ADHD symptoms, but if you have ADHD and anxiety, you will benefit from watching this. Both stimulants and non-stimulants target brain chemicals called neurotransmitters, but there are differences between the two. First, I'm going to talk about stimulants. Stimulants are the first line of treatment when it comes to ADHD, purely because they are 70 to 80% effective. Stimulants work by increasing dopamine and norepinephrine levels. They're fast acting, so you feel the effect pretty much immediately. It's a controlled drug, so it does run the risk of dependency or misuse. Non-stimulant medication are second or third line treatment for ADHD. This is purely because the response rate is a lot lower than stimulants. Non-stimulants are selective norepinephrine reuptake inhibitors, that's a mouthful, also known as SNRIs. They work by increasing norepinephrine in the brain, which helps control behavior. They have a slow onset rate, which means that it does take a few weeks for it to kick in, almost like antidepressants. So you take them and you gradually feel the benefit of them. So a little bit of patience is needed for non-stimulant medication. Non-stimulants are not controlled drugs, so they don't run the risk of misuse or dependency. I'm going to move on to adding anxiety into the mix because people with ADHD usually suffer with anxiety as well, or ADHD has in fact caused the anxiety. Stimulants can in fact make anxiety symptoms worse. So if you are anything like me and you have both, you will probably find that stimulants probably don't work well for you. Experts have suggested that people with both of these conditions should take the non-stimulant route. Your medications are probably working if you notice that your ADHD symptoms have got better and you generally feel a lot calmer. If you notice that you're getting any unfavourable side effects, I would look into changing your dose, changing the medication route, changing the frequency, and also looking at interactions like vitamin C and caffeine. Everyone has a different biochemistry, so medication isn't a one fits all. If you're interested in my medication journey, seeing as I've tried both, follow for part 2.